They're cool.
Powered by Riverside.
All right, that's enough for Riverside. Thanks for that. So today, welcome back, guys. This is SHARC Doc Talk with me, Dr. David Deonson, and Doc T over here. Decided to do a remote one today, and yeah, how are you doing, Doc T?
I'm doing great. We've got sunny skies, beautiful, it's summertime. Kids are sleeping in, so they're happy.
Oh, nice.
Doing okay. Yeah. Kids have sleep past 6:30 in the morning. It's a good day.
Yeah, that's a great day. That's a great day.
My oldest wakes up at 10:30, and I swear to God, it looks like he just came back from Vegas on a bender. I'm like, you've been sleeping 11 hours. How are you this tired?
How old is he now? Like 16?
15.
Yeah.
And we measured him yesterday. He's 6'3.5".
That's disgusting.
My other son's, what's funny, my middle son, we can tell he's growing because he's about eye level with me now. I'm 5'11", 6 foot. But when we measure him, he's shrunk. So I'm not sure if his head is sloped weird or something. It's like, how are you short, but you're not? Yeah.
I don't know.
Very funny. But nonetheless, yeah, we're doing good. We're doing great. We're gonna go hit the beach a little later and just work on that suntan and be lazy. And we got a bunch of new toys for the beach, which I'm excited about.
Oh yeah. So that's the purpose of summer there. That's what you got to do.
Well, dude, I can't just lay there. I get so bored so fast. So my other son's the same way. So my one son's like, he likes to just lay around like floaty almost kind of thing and just chill. But the other one's like, he's got to play. So, just go run around the beach doing stuff. But anyway, doing great.
That's great.
How about you? You got something you just shared with me before we started that it's like, come on, bro.
Oh yeah. So
I did it to 300 last week and you're like, oh, cool. I squatted that for a warm up. Cool, man.
Yeah. So
thank you for being respectful.
I will first. Sorry about that. I will first preface this by it is only exciting if you do this consistently at the gym. If not, you're like, whatever. But
you know what? I'll say this. Sure, there are certain people that'll look at that and be like, cool, and other people are like, damn, that's that's impressive.
So as Doc T mentioned, it kind of had to do something with the gym. It was last night actually. Yeah, last night. I was on my first, or what we call our primary squat day for powerlifting, where you're just going the heaviest you can on that week. And things were just feeling good. Went to the number.
I love those days.
I thought it was gonna just be a number that I had thought about before getting into the gym and what I was like kind of planning to get toward. I hit I think it was like 485, and I was like, that's not what it's supposed to feel like. This feels pretty good. So I just looked at my friends there. I'm like, is it PR day? Which my coach wasn't there, so I mean he wasn't gonna stop me. But I said, is it PR day today? And they said,
amazing how that happens.
They said, hell yeah, it is. And so threw on
that's great.
10 kilos onto it. We just wanted to skip what I call like the mental warm up of just putting something in between. Well, just go for it at that point. So we threw it on.
Don't waste the energy.
Yeah. So we threw it on and got down into the bottom of the squat, and I was mentally ready to be like, this is gonna crush me. This is where I'm at. But I just kept moving. I'm like, oh, this is going. This is great. This is fun. So yeah, I hit officially 230 kilos or 507. So yeah, we passed the 500 mark for a back squat. And yeah, that was great.
No, fairness out there. He's like 5'2", so he only had like 12 inches to move. Wasn't a long way.
Still got it done.
Man, that's a lot of poundage right there moving.
Oh yeah. So the joke now is like I don't have to say excuse me anymore in the gym. We just move. Just got 500. I've earned it. I have earned it. But yeah. So to everyone else that doesn't care, just think about 1,000 pounds. That's basically what I put on my back there. And but yeah, that was
cool.
Cool.
Came back up. Yep. Yeah, that's. I remember. I think the biggest squat I ever hit was like 315. But for us, because we weren't training professionally, like you were kind of doing, right? We always did the increments of 315, then it would be add 10, 325, 335. Like that's all we ever did, right?
Yeah.
I got 315, I tried 320. I got to the bottom and just bailed. I mentally, I was like, I don't like this.
I understand.
When you're down, that's the thing with squat, like you're going down is not the hard part.
No.
When you hit the bottom and you're like, wait, I'm coming out of this? It's
yeah.
like almost like a question mark to your mind, but your body's like, yeah, let's go, man. And you're like,
Oh, yeah.
yes. And you stand up, and it's amazing. When you don't, you're like, it's very depressing.
Oh, yeah.
You're
Oh,
stuck
yeah.
at the bottom. You're like,
But
you
yeah,
know
so
why I
that
always
was
was
it.
bummed?
Go for it. What?
Not to cut you off. I was bummed because usually I was working out when nobody else was in the gym, right? Because I
Oh,
started in the gym.
Mhm.
So if you have to bail, you have to bail off the platform. The
Mhm.
barbell is going to hit the floor and it's going to roll. So
Mhm.
now you're exhausted. You have to chase it, stop it. But now the only way that gets back up on the rack for a back squat is to
You-
unload the bar, put
yeah.
it back up, and reload it again.
Oh, yeah. Oh, yeah.
That's why I was like, I'm not going to miss this because I don't want to go through that again.
Nope. Nope. And then, yeah, so I purposely, whenever I'm going to do something this heavy, I'm going at a time where I know there's people that are going to be there, because I've had patients
Sure.
ask me, like, why don't you just work out here in the office? I'm like, I do half the time, but there's also a point where if I'm by myself here at this office and this isn't quote unquote powerlifting equipment, and things just start moving more than I wanted to, and I get scared and I get pinned, this is a problem. I don't know
That-
what to do.
that-
No
yeah.
one knows what to do in terms of, like, even if someone was here, right? I don't know if everyone would kind of know the protocol to like help lift the bar off me.
Well, if you pass out.
But yeah, pass out,
Yeah,
and I'm
which
done for.
happens.
Yep.
Yeah.
Yeah.
Sweet.
Yeah, and we don't want that to happen. So I go at times.
No.
I know people are gonna be there.
Smart.
But yeah, got it done.
Smart lifter.
Everyone was kind of egging me on to go a little bit more, but I wanted to leave with eggs in my basket, if you know what I mean there. As in, I got what I needed. I probably could have pushed a little bit more. I'll probably push a little harder in a couple weeks. But I got I got business to kind of take care of right now.
Yeah, and that's the funny thing. That's how you know you've gotten older, right there.
Mhm.
You know what I mean? You know you're
Oh, yeah.
getting older because you're like, I got to work on Monday.
Yeah.
Okay,
Yeah.
I got to be careful. But when you feel that good, honestly, that means everything is clicking. Like
Mhm.
when we tell our patients that we talk to them, we say, we're trying to teach your body how to make sure everything's lined up and clicking the way it's supposed to.
Yeah.
That's the whole point. And when you feel that, go. You got it. And you're right. I'll ask one
Mhm.
question to you.
Mhm.
My philosophy, my thinking, my theory on this is you should have warm up the waiting for mentally.
Yeah.
But I don't feel like, if you know your body, I feel like if you would have done what I classically would have done, which is like you hit 475, was it?
485. Yeah.
485?
Yeah.
I might have gone 490.
Mhm.
Right? But it's like, no, jump. Just don't. Why not? Because you miss,
Yeah.
you miss. But if you're feeling good and things are moving well, don't waste the energy on a rep that isn't where you're trying to get to.
Oh yeah.
Now, I'm not saying jump from 135 to 507, but I'm saying,
Don't do that. Yeah.
don't do that. No, that's not prepping well.
I think it depends. Because I actually do that. The 5 or 10 pound incremental jump. Here and there, when I call it like my average days, where I'm just not feeling good, but it's not feeling bad. Because sometimes my body just has to
that's smart.
feel it.
Yeah.
But if you're feeling fantastic, like the bar feels snappy, doesn't feel like you lifted anything. Because that's what like 300 something felt like that night. I'm like, oh well, might be something today. I don't know.
Yeah, you racked and you're like, that was hard.
Yeah.
Oh boy. Oh boy.
So because of that, yeah, we just went for the jump, and obviously my brain wanted to be the quote unquote smart one and take the incremental jump, but I knew that I probably should have gone a little heavier, so I just asked my friends to talk me out of
I know.
it.
Yes.
But they didn't talk me out of
you're
it.
because it wasn't
Go
like
for it.
it's 10 kilos is it's a weight, but
Yeah.
I mean, it's not like you're putting on another 20.
Yeah, still fair, but like
That's good.
normally,
That's
let's
awesome.
say if it's a bad day or if it's like just an okay day, I'll take the incremental jump just because I'd rather just make sure the technique is clean, make sure we're good and we're not
Yeah,
gonna hurt ourselves.
100%. Because remember, you were still on a lift tomorrow.
Oh yeah, oh yeah,
You know what I mean? Or the
100%.
next day or whatever. So, yeah.
oh yeah.
Life lesson. See, I have rubbed off on you. You're so
Yeah,
welcome.
yeah, I
The
appreciate it.
52-year-old mistakes I made, you're learning.
Well, once you said, I stress fractured my pelvis, I'm like, I don't want that.
Okay, I'm not. Okay, yeah, you win. You're crazier.
Yeah.
It's funny. There are certain things that, you learn from others that may not click until that there's some moment in your life you get to, and you're like, yeah, no, I'm good. No, I'm good.
I'm good.
Yep.
I'm good. Like, I thought whatever you're doing was super cool. Don't want the stress fractured pelvis. I could
No.
live without telling that story.
Yep.
But funny
It's
enough,
not fun.
kind of kind of talking about what we were talking about today, guys, was like the relationship between our coaches, because like my coaches weren't there, but also funny enough, who else was there at the gym with me was like obviously me. I was one of the docs there, but one of the other guys was a PT in the room. So he also like partly owns the gym there too. So we have fun discussions here and there. But we get into this weird world of having to have a relationship between your strength coach or your golf coach or whatever coach and you as the doc. Doc T, in your experience, how has that been for you, and how do you navigate those relationships?
Well, I think the first thing you want to do is you make sure that everybody understands. So
Mhm.
when we work with trainers, there has to be an understanding of, what my role is and what your role is.
Mhm.
And so usually when I meet them, it's usually through a client. So I have a
Mhm.
client that happened to see me and then found them or vice versa.
Yeah.
I'm answering the question, right?
Mhm.
Okay, yeah. I want to make
Yeah.
sure I was on the right page.
You're good.
So it's like, okay, that's what he asked, yeah. So it's one of those things where when you meet him and talk to him, do they understand that I'm going to help your clients like get to the point where they can stay in the gym with you,
Mhm.
so you don't have to do PT with them?
Yeah.
And then they're going to be in my office. I'm not going to personally train them because that's not my job, not my role. They're with you. That's
Mhm.
the whole point. So I feel like I'm not answering the question exactly.
No, you're doing great. You're doing
Am
you're
I good?
doing
Okay,
great.
go. I was
Yeah.
like, mom is right. Okay. And so that's a developmental thing. And so it's
Mhm.
always interesting because I've run into trainers in the past that'll try to literally try to adjust a patient of mine.
Mhm.
And I'm like, why are they trying to adjust you? Like, that's weird. And so
Yeah.
those are the things like I always tell, what we tell clients with doctors, there's red flags with doctors, there are with trainers and everybody else. But as far as us goes, that's kind of what I look for. I'm looking for someone who understands the symbiotic relationship we have, sees the benefit of that relationship. And the
Yeah.
best example I can give, kind of off the top of my head, is Mark Reed, our golf pro.
Mhm.
I was talking to another person about this the other day. What I love about him is he can look at your swing and see something wrong,
Yeah.
but he can't figure out what it is. So then he sends them to us.
Yeah.
And then we figure out what's wrong and we fix it and
Mhm.
send it back. He goes, yeah, now it works. I'm like,
Yeah.
that's the kind of relationship you want.
Mhm.
Because now, especially the client gets nothing but benefit from that because now they have four sets of eyes on them
Yeah.
and they're two different viewpoints.
Mhm.
So you're not going to miss much. So yeah, I think it's a great way to kind of keep that person moving and grooving.
Oh yeah. Oh yeah. In my experience with it all, I think in the world of sports rehab and chiropractic or physical therapy, whatever you want to call the world that we live in right now,
Right. Yeah,
um,
seriously.
there's a lot of people my age that are trying to get more into the strength programming and rehabbing. Strength programming for rehab, which I understand. Um, but especially when someone's working with me as a coach, I'm not trying to take any of their patients or not patients, their clients away from them. Like my whole goal is just to give them back to them. So I'm not trying to
Yeah.
overstep that boundary. I'm not trying to market myself as a trainer. I just know there's a couple exercises here that make sense with this person's current program right now based on
Mhm.
the pain that they have. So whenever, like for example, I have this one patient, she is a high rocks aficionado at this point. Like she loves going to them. She's gotten to like 5 in the last 2 years or something like that.
Oh,
Has
wow.
done the pro. She's just all in, right? So, she also has a high rocks coach, but I also program some stuff on the side for her. Now, I always ask her like, "What does your coach have you doing right now?" I want to see where they are in the macro cycle. I want to see the whole periodization process because I also know if I give her like a 45-minute program, she's probably not going to be able to go do another 45 or hour program on top of it. I'm just trying to
Probably
supplement
not.
what the other person is quote unquote missing, not because they're
Right.
missing it on the pain aspect, but they're aiming for performance. I'm aiming to make sure that they can perform well, and
They're aiming for
it's
performance. You're
that.
aiming for movement.
Yeah,
You're trying to
yeah,
fix movement. They're trying to fix performance. They're two
mhm,
different things. Yeah.
yeah. And I was having that discussion with her because like she was thinking about cutting costs on certain things and just coming to me or just going to the person. I was letting her know like, hey, I have my space and I can make sure you do the best that you can. My goal is not to take away from the richness that the coach is going to give you in the knowledge that he has for your sport. Because I know sports, I don't know high rocks like that. Right? I know how it
Right.
works,
Right.
but I don't know it like that. Um, so I just say that if you have a team behind you working at what you need to get toward, then you're probably better than a person that says they can do it all and they're probably too tired to really really pay attention to what you need. Because I've
And
written
true,
like 5 programs. And sometimes we're like, oh yeah, I missed this thing on that person. That's my fault.
when you write
Yeah.
programs, this is the thing that people don't really understand. Because I've done strength training for teams and stuff like that.
Yeah.
It's a hour and a half a day, 2 hours a day. The programming part is not just some, if you have a good trainer, it's not
Yeah.
some like your workout plans. It's not some random
No.
template they got from ChatGPT or something like that.
Mm-hmm.
This is the coach that knows you personally, knows your weaknesses, your strengths, your everything. And now they can put a program to help you gain strength in your weaknesses and maintain your strengths, right? Like that's the whole point. And High Rocks, like High Rock is nothing different. Like it's CrossFit just today, right?
Yeah.
Even back then, I had people go, "Oh, I like the way you program for rehab and everything. Would you train me?" And I was like, "Hell no!" There had a couple guys like, "You're a top level athlete. I need to fix the things that are going to break on you because I can see that. But you need that trainer. And it's worth the money because this is the one thing I think a lot of I don't know. I don't know if it's the AI stuff and the online stuff is good and bad these days. The bad part is the computer's never actually seen you move, right? They've never seen you do a workout, never seen you do anything. They don't watch you do carries and see how it works or whatever. But when you start breaking down the body in a certain area, if you get hurt, now you're out. Now you have to come see you 2 to 3 times a week for a few weeks to get right again. Then start over training. People don't realize when you really get hurt, like I stretched faster with my pelvis. I couldn't do serious lifting for 5 months. And then for the next 6 months, getting back to just a functional movement being like goblet squat 20 pounds without hurting. That's a year of my life. So you have something like that, and someone you like training with you per se, and you miss something because that's not your expertise really. Now everybody loses. So it is one of those things you're like, it's knowing your lane, staying in your lane. And, doctors out there, young doctors especially, because they're, if they're anxious because they want to get moving, you take on clients like that. Like it's almost more, I'd almost say it's more time consuming being a coach for that High Rocks person than being a doctor for that High Rocks person. Because you already put the time in to know what you know. Now it's simply applying it to different people. And that takes the initial exam and about a visit or two, and now you got to get them. When you're doing that stuff, dude, like you hit 507, your coach is like, okay, I'm doing great. What did I do right? What did I do wrong? And how can I tweak it? So they're back on, you're thinking about you again. We see a patient, we got them fixed. They're doing great. Cool, man. I'll see you in a couple weeks.
No, yeah.
You know what I mean? We've done our job. Like go do that now. So it's an interesting thing when people take it on too much and kind of get in the wrong lanes. Cause you're like, it's like no different than a trainer. Like I literally had a trainer try to adjust a patient of mine, their neck, by the way. And you're like,
we also
that's not the easiest thing to adjust.
That's also not technically legal either.
Yeah, it's illegal to begin with, but it's one of those things where, they're like, oh, I saw this on TV, but I'm like, it's not. I stayed at, what was it? What's the hotel? I stayed at a Holiday Inn last night. The commercial that says, I'm like, I
think I know. Yeah, you got to send that to me. I think it sounds oddly familiar.
Yeah, but it's one of those things. Like it's just a matter of, the relationship between the two is amazing. And of course, money is going to come into play. If it's something you're going, I can't afford both right now. It's like, well, then you have to figure out strategically where to put us.
Yeah.
Because we're not going to hurt you. We'll make you feel better, but we're not going to make you win a High Rocks.
Oh yeah.
That coach will. And that coach is going to take care of that piece so you don't get hurt. And then we'll make sure the other piece is fixed in so we keep you moving where you're supposed to. But it's like that's something you just figure out as a relationship.
Oh yeah.
And that's the great thing when you have a great relationship like she has with you. It's like,
oh yeah. Like, and I also told her too, like, if money is the issue, just let me know. Cause we've worked together for some time at this point. So I know how to navigate those things, like what is necessary for how many times you should probably be coming in. And then I already know how her work ethic is. So I'll be like, okay, so yeah, don't come in this week. Come in next week. We'll space out a couple things. Not a big deal.
And I've had patients, I had 3 or 4, because back in the day, a lot of people like when I was starting out, their expendable income was like to the gym for the membership, right? And so someone said, then just send me $50 a month until it's paid off. Yeah. Like I literally put them on a payment plan. They were like, it's only like 4. It wasn't like the bulk of my practice. It's not a normal thing, but they're coming consistently. They're doing all the work I need to. I know where they're trying to go. And one of the girls was wonderful. She paid me off. And the note said, I've never been so happy to not see your name on my checkbook ever again. And I kind of laughed, like it was sweet. And she said, "It was a nice card, right?" And he said, "I'll miss you, but you take care." And it was like, that was
Oh
great.
yeah.
And I was like, and I had no problem with that because
Mhm.
we had a great relationship. And that's what the relationship is so important with the doctor and the client, right?
Oh
But,
yeah.
and then with the training plan. So yeah, I'm all over the place today. Sorry, guys. But
You're okay.
nonetheless, that's that option. But that them telling you that allows you to create that space,
Mhm. Oh yeah,
which
and I
is great.
think that the biggest thing that I've learned with that too, in just my short time of practice, even whether it was like with the charges here or even like the coaches, it's like everyone has a spot at the table. It's just if I'm trying to
Yeah.
reach for the turkey and the turkey's all the way over there, I'm gonna be overstepping some boundaries, and that's not the point, right? The point is we're
Nope.
supposed to be working together to make the best decision for this person in front of us that is coming to us for our expertise here. I guess the question is has there been times where you felt that it was just better to send out to a coach rather than you take on the training yourself?
100%.
Mhm.
I've only had, because there was a time when I was mixing strength training with
Yeah.
uh, being a doctor. Now I was like, the rowing team or some of the former team, volleyball, whatever. So it was kind of like a friend thing. I was getting
Yeah.
paid to do it, but I was helping them out, right?
Yeah.
I realized I don't, because it's time consuming. I spent more
Yeah.
time programming and thinking about the individual people and the tweets and everything than I ever wanted to.
Mhm.
And so I kind of stopped doing that away. So for me, it was one of those, I think the functional training thing, like we had a professional golfer a few years back
Mhm.
come to us, right?
Yeah.
And we were really on just working on his function stuff. But
Yeah.
he was actually a strong kid. He was very good. But that's all we were working on. I'm okay with that. But if it
Mhm.
comes personal training, then it's like, unless it's a good friend, like a family friend, and
Oh,
there's
yeah.
trust things there. But as far as referring out goes, I will always refer out pretty much everybody. That's why I have the network I have out there. Just,
Mhm.
hey, these trainers, and that's the great thing when you build a network of a few good trainers, you know who's going to mesh,
Yeah.
right? Like, I need a trainer that's going to help me put on the brakes.
No,
You
yeah.
don't have to worry about pushing me. That's not the problem,
Oh,
right?
yeah.
Where somebody else might be the trainer that needs to motivate him more.
Mhm.
And it's like, it just every trainer is a little different. Like I had one trainer that just yelled at everybody. And I'm like, so I have sensitive people. I can't send them. They'll leave in a
Yeah.
week. And
Oh,
so
yeah.
everybody's uniquely different with that. But yeah, I'm a bigger fan because again, you get to see this at the Chargers, man.
Mhm.
We're in a room where collectively is like $2 million worth of education, if not more. You
Probably
got
more.
orthos, you got generals, you got the trainers, you got PTs, you got chiros, massage therapists. We're
Yeah.
all in there. And so to be able to have them come to us and say, look, I know this pretty well. You know this really well. Can you do this for them?
Yeah.
Right. And it's like, absolutely. And then I'm like, okay, I know this pretty well. This is your job. You go
Yeah.
see them,
Mhm.
And so it's that cool, again, I love that word too, symbiosis between the whole thing. And that's the kind of trainers that you want that relationship with because I can train you. Am I educated? Yeah. I have all kinds of like letters after my name. Awesome. But
Alphabet soup.
it's not, yeah, it's like, that's what it is. Right. But it's like, I don't want to do that
Mhm.
as a profession. That's not my passion.
Yeah.
Right. I'm interested in it. I'm curious about it, but it's not my passion. And so
Mhm.
trainers should be passionate. A coach, whatever, whatever you want to call it.
Yeah.
So yes, to long-windedly answer your question, yes. And then I'd like to work together with them
Oh, yeah.
because as they gain strength, they're going to have nuances. And that's what I was talking
Mhm.
about with you the other day when you felt good. Everything was locking in at the right time,
Yeah.
right? If it all locks in at the right time, you're going to feel amazing because
Oh,
you're
yeah.
efficient,
Oh,
you
yeah.
know? If
100%.
you're not, like, what was I at? I think, and not to make it personal, but just,
Mhm.
I think I was doing a goblet squat warm up and I couldn't get the stress out of my back. I just couldn't, no matter what
Yeah.
I tweaked and tried, it just didn't work. So guess what I didn't do? I
Goblet
didn't
squat.
squat.
Yeah.
I went ahead and did single leg stuff. I was like, I'm done because my body, for whatever reason, is not locking in properly. Who
Oh,
knows
yeah.
why? And so that's the kind of communication you have with the trainer. Like, trainer, like their bodies aren't locking in. What do I do? Send them to my office. Because the great
Yeah.
thing is, you and I talk about this normal patients. I might see them a couple times, figure it
Yep.
out. Here you go.
Yep.
Go
And
have
that's
fun.
fine. It's like
Yeah.
I think we've mentioned it before, but I'll mention it even more so right now. Like our goal is to actually like kick you out of our office. Like we love that you
Yeah.
come in, but I want you to be out there doing what you love doing, right? Whether you want me to be a part of like the process or not is really up to you guys and based off the clinical decisions that we make together. But the ultimate goal is, yeah, if you want to go play basketball, I don't want you to have to spend all your time in here right now just to warm up to go play basketball. Like, I want you
Yeah.
to not have to worry about it and go play basketball. Then we
Yeah, you
can
should.
work on other things.
Yes, it's like you shouldn't need us,
Mhm.
right? Now, and the great thing, here's the wonderful thing about,
Mhm.
you know, and this is where I can honestly say with you, I was fortunate that my mentor was what he was to me. You're
Mhm.
fortunate your mentor was what he is to you.
Yep.
And we got to learn techniques, soft tissue stuff that we do in the office
Mhm.
that is, in my opinion, kind of unparalleled. Like even the machine, that machine thing, I can't what
Shockwave,
it's
yep.
called. Yeah, even that machine, it doesn't know what your tissue feels like. It's a machine. So
That's
it
a whole
might have some
podcast in
benefit.
itself.
No kidding. And actually, that's a good one. We should talk about that one. But not to go sidetrack here. But
Mhm.
it's one of those things where our hands, especially like you're learning now, 'cause you're really
Mhm.
starting to use them more and more and more. I can close my eyes and touch a body part, tell you what it is, and where the knots are. And I can do it, seconds because I've been
Mhm.
doing it for 20 plus years. Not because I'm super skilled. It's just 10,000 hours, right? We can affect change in tissue for those same clients.
Mhm.
So it's not like they're coming to us just because they're hurt or
Mhm.
just because they're back in this or we're trying to fix every little movement piece so every cog works perfectly. It's
Yeah.
we can actually grease the wheels pretty good too.
Mhm.
So that now you're even more ready for that event.
Yeah.
Or your training takes on a different efficiency, hence a better intensity.
Oh yeah.
So it's one
Oh
of
yeah.
those things where we have a lot of skills we can do with all that. So it's half the battle, I think, is really with our clients, is figuring out where they fit in our world,
Oh yeah.
or where we fit in their world, I should say, and then working with the trainers so they can understand it. Because what we do is unique. We have a
Yeah.
bunch of docs out there saying they do it, right?
Mhm.
And I always laugh. I go, I haven't seen any of them in my training room chargers, not one.
Yep.
And so I'm like, they're not at that level. I don't see them on the sidelines for USC. I don't see them at the up. I don't see them in these places, and
Mhm.
that's not knocking them, but I've seen them selling packages and plans. I'll get you back ready for this event. I'll train you for this event and treat you and whatever else. And I kind of look at that going, you're trying to tell me you're a professional at two different things.
Mhm. Yeah.
It's really hard to be the best at both.
Oh yeah.
And so it's really that, again, staying in your lane thing. I'm like, as a doctor, unless you love training people, that's a
Mhm.
passion too. You know what
Oh
I
yeah.
mean?
Oh yeah.
Yeah.
There is a crossover that can happen if you do it right, but there's,
Yeah.
like you said, it's trying to wear two hats at the same time and be fantastic at
Yeah.
both. And you only have one body and you only have 24 hours in a day. So
Yeah.
I
Yeah.
try my best to stay within my lanes, and once I feel like I'm over my head on a couple things, I'll be like, okay, it's time to send out. This is the
Yeah.
perfect time to send this person out. I guess
100%.
this is a fun segue into this part. Now, with our patient, let's say it's just patient A, right? Came to you for the pain just because they're training with the coach, and it wasn't working out. Oh, I shouldn't say it wasn't working out. They just hit a plateau because of pain, right? You get them back to where they want to be, and now they're feeling fantastic, and you're sending them back to your coach. Where do you feel that we work best at that moment in time? Do we stay hands off with that patient, or do we continue on in certain ways? How would you approach that?
Okay. So that's my
Mhm.
departure talk. So
Yep.
it's a thing we're going, you know what? You're doing really well. I'm going to reach out to your trainer. Because that's the other thing too, is
Mhm.
I've trained you or raised you, if you will,
Yeah.
to reach out, like communicate.
Yeah.
Because if they feel good, but they go
Mhm.
back to the gym and start training, say High Rocks athlete, right? High Rocks, I
Yeah.
bring that up because like
It's new.
there's so many variable movements. Yeah.
Yeah.
But you're moving in so many different ways. It's not like you're going to squat. We're only squatting one way.
No, yeah.
So, right, there might be a nuance. You shift forward, you shift back, you shift
Yeah.
side to side, whatever, of course. But in High Rocks, you're all over the place. So the coach needs to watch. You communicate to the coach, say, look, this is what we found. This is what I saw. Like we do in the training room to the team.
Mhm.
I see this, this, and this. All right, cool. They're going to make a note and keep an eye on that and see how
Yeah.
it goes. From there, I tell them, look, you know what I can do for you. You know how it feels and what it does. So you have to kind of insert me into your world where you see it fits.
Yeah.
Because for them, I could tell them idealistically, right? Like when you set up rehab exercise, right? Here's
Yeah.
how you're supposed to set up, right?
Yeah.
However, your frame is different. Your
Mhm.
hips are wider or rounder or more oval or whatever. So adjust your body. But here's the most important thing. This is what you're supposed to feel. So
Mhm.
let's line you up so you feel that. So same thing with them. It's kind of like I could tell you all this other stuff, but honest truth is, every couple weeks, every 3 weeks, come in. The soft tissue you've stressed, it's going to need to be worked on. I promise you did not hydrate, eat perfectly, and sleep perfectly over that 3 week
Yeah.
span, right? So these things come up. We know there's a tendency you have to cause stress in this area, right?
Yeah.
So let's work the area. Let's make sure
Mhm.
everything's going on. I tell them I'm going to be you got your coach over here on your shoulder. and then you got me on the other shoulder. And I'm going to talk to you, whisper in your ear once in a while, going, hey, get in every few weeks. Are you doing your rehab? Are you doing your exercise? Like, it's a
Yeah.
good way, cost beneficial, to utilize the
Yeah.
skill set that you and I have.
Mm-hmm.
And that's how I work. So I tell them, look, you got this in your corner.
Yeah.
And you know what it can do for you. So
Mm-hmm.
don't
Oh,
forget.
Oh yeah.
That's the best way I look at it.
Oh yeah, I'm definitely along the same thought process. Like, hey, I'd rather you just go to your coach, but you know where to find me if something's going wrong.
Yeah.
And I usually will say this too. Like we've said this in our office multiple times. Like, once you're feeling good, doesn't necessarily mean that the whole thing is over. You're just feeling good at this point. So there's a couple things that may be missing, or now the other side of it all. You start moving a little bit differently, so stresses are on other tissues that you didn't realize that you weren't using or weren't using well. So other things might pop up. I usually say,
You never know.
although you came in for a back injury, if for whatever reason, because of how biomechanics can work, let's say your shoulder hurts now because you're in a throwing type of sport, and that never happened before, and so unless we changed training, changed rehab or whatever, you can still come to me for your shoulder, even though you saw me for your low back. Because now things are different.
We actually still have a client. It's very
Yeah.
funny. I still have a client today who I've had for over 16 years, I think, who asked me at year 7, I think it was,
Yeah.
do you actually work on ankles?
Yeah.
I was like, yes, of course. But no, it's very true. I don't try to install, like, I'm not a big fan of pushing myself on clients, right? Like, you came to me for XYZ, we finished,
Yeah.
you're good. Don't do the dumb stuff again, and I'll see you later.
Yeah.
And ultimately, and we always joke about our motto, like, we know you because we are you, right?
Yeah.
I know full well these people, if they're not going to do something stupid in this area, they're going to over here and do something stupid in this area. And I don't mean stupid as insulting, I mean because you and I do stupid all the time.
Oh yeah.
It's
we
like,
do it all the time.
that's why we know this, right? And so it's one of those things where I just let them know, like, just don't make it a long time, especially if they're competing in events. And the only reason I say that is, whenever you're competing in sport, you can't control the outcomes,
Oh,
right?
yeah.
You can't control what your body's going to do. You can't control how it's going to pivot or jump or move or carry or lift or bend over or whatever. You
Mhm.
can't control that, especially in a sports setting, because you're doing, sorry, this bud, I hate these buds. It constantly wants to fall on my head. So, okay, whatever. So just keep that in mind, that if you feel something's off, listen.
Yeah.
Listen to your body. As an athlete, that if you're not listening to your body, then you're missing a big piece of, like,
Yeah.
that thing. So it's like, back off a little bit, let it
Mhm.
rest and heal up, give us a
Yeah.
holler, come in and let's see what's going on.
Oh yeah. And then
And
just
sometimes it could just be a muscle. Yeah.
oh yeah, could be. And
Yeah.
then with that part of that advice to the athlete, when you're saying just listen to your body, I would say listen and communicate it to us or your coach or both, because sometimes
Please.
it's just you could be feeling off because you didn't sleep well or you just had a bad night. Things are just being the
Yes.
things that they are, or it could be a technique thing, or your body's overworked. We don't know unless we see you and you communicate that to us. Because if you just say it's pain, then that's very broad. But if you say that it's
A lot
I
of
feel my
reasons for that.
back, yep. So I feel that my back is doing this at this point of this motion. I'm like, okay, I think I know what we're gonna work with. But yeah.
It's crazy. And you've seen this in being treating clients. I've had, like, knee pain patients, right? Whenever they squat.
Yeah.
And I'll work the usual suspects. And it's like, it helps with the knee. No, they don't have to like, one guy did his calf, right?
Mhm.
Worked his calf, got in tip buzz. I really got in that calf. He stood up, pain was gone.
Yeah.
Pain was completely gone. And now we can dive down, and it's always the same thing. Why? That's what we're always answering the why. That's what we're after. Why did this
Yeah.
happen to you, right? This could have been flat out, you were dehydrated one day, you went for a run, the calf just tightened up on you, because whatever, and you just didn't stretch it out, didn't do anything, and let it be. Maybe it's because your hip was inefficient that day. Like, any number of things that
Mhm.
happened that day, but like my back that day. 2 days later, I felt fine.
Yeah.
I didn't do anything magical to myself. I just
Mhm.
I just was having a bad day. Now,
Oh, yeah.
mind you, I've also overworked my body a lot, but anyway, the point being is that, so sometimes you just need to work on these things. And if that client turned to me and said, well, why is this happening? Well, then that we can go down that rabbit hole too. And
Yeah.
that's a fun rabbit hole, but that's a rabbit hole. I say that specifically because that's what it is. We
Oh, yeah.
fixed your calf. Your knee doesn't feel bad anymore. Your calf is an issue. There's probably some running techniques or whatever techniques you got to think about, but otherwise you're good,
No.
and that's an easy pick off. Come in, get out, go do your thing. And
Yeah.
if you want to dive deeper, then we go deeper, but that's,
Yeah. So it sounds like coaches and sports docs, whether PT or chiro, we have a great symbiotic relationship if we do it right with the client.
You know what's funny is you brought up
Yeah.
PT.
Yeah.
When I started out my career, PTs and chiros were like the nemesis to each other.
Yeah.
And I always laughed at that because I thought we trained the same. We all know the same stuff.
Very similar things. Yeah.
Yeah. I mean, there's stuff we do more than they do. Like if you got a post-surgical, ACL, shoulder, go to a PT. That is, and there are chiros that take that on, and there are some good ones out there. Not a lot, but there's some good ones. But PTs, that's literally their specific training point. And it's like, I love that piece. They're really good at that piece. Then when you work with PTs like we do, it's like now the PTs in us all have to understand, like, especially with our skill set, particularly you and I, that PT is like, you know what, I'm kind of done now. Go see them. Because they've got this whole tool bag that I don't have that can do all kinds of cool things for you too. And so it's even with PTs, like it doesn't matter, the massage therapists, like sometimes people are just tense all the time because they stress out and their neck's like this all the time. Go see the massage therapist.
Yeah.
Just go see them once a week, once every other week. And, you know, it's, yes, I can snipe it and clean it up today, but you're going to screw it up tomorrow.
Yeah.
You know, I have one funny story. I'll share this along the same line with trainers too. I had a patient, she was laying on the table. Her head was this high off the table, about 1.5 inches. And I said, oh, go ahead and relax your, go ahead and relax your head. And she goes, I am. I'm like, you're 1.5 inches off the table. She's like, oh. And she pushed her head into the table, like hard. And I was like, okay, I sent her to an acupuncturist that I had. You know why? Purely, she's going to be forced 3 days a week to go there for 45 minutes with needles in her head and lay there and relax. And that's all she needed. 3 weeks later, she came back in for a follow-up. She's like, I feel much better. I said, there you go. My skill set is not for her. She needs a different thing. And so I think she did that massage and things were fixed. So same thing, personal training, like same kind of relationship. Like I'm not going to train them, but you shouldn't be treating them either. That's the one pet peeve I have is diagnosing.
Yeah.
I used to have trainers, 10 people who come over me and they're telling me, oh, my trainer said it was this, this, and this. I'm like, awesome. Now I have to not be disrespectful simultaneously.
It is tricky because especially in this whole world of social media now, it's very clickbaity to see like, I hate to bring it up, guy with the shirt off to have their 6-pack out and they'll be like, yeah, if you have back pain, go do this. And I understand the sentiment of it all because you're trying to help your client base and you're trying to show that you're well-rounded, but also you don't have the understanding like, okay, is the back tight because it's a biomechanical issue, or is it the back tight because it's a nerve issue, or is it actually an unseen cancer that we just haven't seen yet? Because yes, your client lost
drive 7
40
hours.
pounds. Yeah. This person lost 40 pounds. Was that because of you or was that because something else?
Yes. There's a lot of, like, we're taught, I was doing with doctors, we're taught for the red flags. Like in our minds, as we're talking, like one person's like, it pain's so bad, it's killing me. And I'm like, are you serious? Or are you just exaggerating a little bit? Yeah. Because I have to treat you what you're saying. So there's red flags we're looking for. And a lot of times they come in and it's really not like that bad. Or you're looking at going, oh no, this is bad. Yeah. But my one thing we're going to do some pet peeves. We should do this at the end of every podcast. We're going to end with our 3 pet peeves of the week. I think it's great. Is when you see somebody chime up on Instagram or social media and they say, here are your 3 quick fixes to fill in the blank. And I kind of laugh because there really is no such thing as a quick fix, first off. Secondly, you're guessing. So you think you know what's wrong and you went and looked up online. And I've had people tell me they have sciatica and they're pointing to the front of their knee. And I was like, that's not even physically possible. But it's like, but that's what they found. And so those little things that drive me nuts, like down 6-pack abs, I'm like, that's a bodybuilder who busts his butt to look like that. Yep. Not that he doesn't know anything about the low back, but I promise you, he didn't even know about your low back. And they take away from these people who was like, if your back is so bad for 2 or 3 days, go to a doctor. Yeah, please. Go. You need to go. Something's wrong. If you're with your trainer and your back's always hurting you, it may not be the trainer. Something might be wrong. So that's kind of those red flag things we talk about. Like, we're here for a purpose. Like now, if the question becomes like the way I hold the bar is painful, then maybe they might be able to talk about it. But like for us, it's like if that whole motion hurts, is it a spasm or is it the joint that has a stress fracture on it? Let's go figure that out together. I had one of those. Yeah. You know the stress fracture in the pelvis. I don't want that. I doctored myself, and I'm a doctor, and I doctored myself and still got it wrong.
Oh yeah, and
That's how dumb I am. Yeah.
and you have all the alphabet soup by the end of your name, so
Yep.
technically it shouldn't have passed your brain. But at the same time, we're also another set of eyes. I'd rather like send them back to that coach if they like working with that coach. But I need to know if that patient is actually doing the best for their body. Like one of the first things that we ever talk about in the profession is first do no harm. And if you're just giving
Yep.
someone random exercises after not clearing anything else, you're kind of doing some harm to this person because now they're
Yeah, you
believing
are.
that they're okay, which I'll say this, a lot of times they can be okay. That's why a lot of those quote unquote quick fixes work. But that's not always
Yeah.
the case. So just
That's more like hope
run
as a
through.
strategy.
Oh yeah. So there's a lot of
And
pet
here,
peeves that we can get through.
well, so give this example. This is a great example, and I hope that we get
Yeah.
this online or posted. But with my stress fracture, let's say I was seeing a coach.
Yeah.
Right. And that coach, because I had hip pain. Now, mind you, I have a stress fracture, but I'm still squatting.
Oh yeah.
Right. Still deadlifting, power cleans, busted snatches, like everything. Right. So if that trainer goes, oh, just try these things, and they're the wrong things, because I asked the doc when he was doing the imaging, I said,
Yeah.
so when can I get back to training? And he laughed. He goes, you're one bad move away from this femur shooting up to your pelvis.
Oh yeah.
And if you think it hurts now, wait till that happens. And I was like, because it was all the way through, right? But I was still lifting. I had
Yeah.
gained enough strength, like you have now.
Mhm.
I have strength that I could circumvent that stress point, but the stress is still going there. So
Oh,
if
yeah.
that coach goes, oh, you're fine, just take a week off, let's just do this, this, and this, and then they go into squat one day and their pelvis breaks open and their femur shoots up. Now what?
Yeah.
Now you got a client lying on the floor, screaming by birdie, calling 911.
Oh
Like
yeah.
those are the things you need us, because if I had come and seen you, right, say I'm
Mhm.
that client, you would have done all kinds of tests on me and said, this doesn't look right.
Yeah.
Like nothing's adding up. You need to go get a picture, make sure everything's okay on that joint.
Absolutely.
And
Absolutely.
that's literally our biggest purpose in a trainer-doctor relationship. Like, we're going to make sure the little pieces aren't missed so that the trainer's protected and the client's protected.
Oh yeah.
And that's our biggest purpose too. So that's
And
where the
that's-
trainers can sometimes overstep that, get in the wrong lane.
Oh yeah. And that's no complete shot at the trainer. Like we understand what you guys are great at, but understand what we're great at too, right? We should work together, and that's how it should be.
Best relationship on the planet.
Oh yeah. I feel like we've beat this dead horse multiple
did
times, but
great.
in a good way.
We
We're
did
doing
great.
fantastic.
Yeah, we did great. Yeah,
feel
no
like
problem
you
at all.
Anything to add on to this talk? I feel like we
No, I think that just it finally clicked in my head for the first time ever
Mhm.
when we talked about my pelvis yet again. But I was like, oh yeah, that's a great example. If I'd been going to a trainer instead of in a doctor's office,
Oh
who
yeah.
knows? Yeah, so I got lucky.
Oh yeah.
That's really what it was. Yeah.
Oh yeah.
So yeah, that's
And-
good. I think the important message is to make sure that you understand
Mhm.
what the lanes are, what our goals are.
Yeah.
As a young doc, don't try to steal clients from trainers.
No,
As
not-
trainers, don't try to be a doctor to clients. Like it's just simple things, but yeah, there
Yeah.
is a great relationship there.
Oh yeah, if we work together, we just get patients to what they need to do, right? And then
Yeah.
obviously we always have to talk about your stress fractured pelvis because who does that is the question. It's like a who, what, how?
I've never met anybody else who's ever done that.
Never.
Shins splints and the stress fractures, absolutely, but never.
Never
Yeah.
stress fractured pelvis. So I will always applaud you. And we'll always say that Doc T will have worse injuries than I have, just because, like, yep, I'm not doing that.
Oh man, that's life lessons right there.
Yeah. All
My
right.
mom always did say I was special. But I'm tired of playing by ear anyway.
Yeah. On that note, I'm Doc David, and this is Doc
I'm
T.
Doc T.
And this is SHARC Doc Talk, and we're out.
See you guys next time.